welcome to another episode of BioLogic Science News. Today I want to talk about a really fascinating and exciting review study that analyzed the scientific literature for psilocybin-assisted therapy for social and mental disorders like OCD, addiction, and social anxiety. The study examined 7 clinical trials conducted over the last 10 years that used psilocybin as part of a test on the efficacy of various therapeutic treatments. Psilocybin is the active component found in psychoactive mushrooms, or magic mushrooms, which is a popular drug used for numerous purposes by many people across the world. Some people associate magic mushrooms with LSD, although these drugs have differences in their perception-altering effects that make them quite distinct. Magic mushrooms have a bad taste, kind of like moist dirt. But despite this, they've been consumed for thousands of years as part of religious or social rituals, for psychological therapy, as an aid to introspection and examination, or meditation, or creativity, or spirituality, and even as a tool to calm the existential fears of those who are near death, those who are old, or suffering from a terminal disease. Psilocybin is sometimes referred to as an entheogenic compound. The psychonaut author, lecturer, and writer Terence McKenna called psilocybin an entheogen, with a root word meaning to generate God, because consuming enough psilocybin can induce a psychedelic trip strong enough for you to perceive and experience with the divine, or what you perceive to be God, or to achieve ego death. I'm getting off track, but the point I'm trying to make is that psilocybin is a naturally potent, mind-altering substance that's been used spiritually, therapeutically, and recreationally for thousands of years. The research study that I want to talk about today found a whole bunch of qualities about psilocybin in combination with therapy sessions that made it a more effective treatment for anxiety and depression and other conditions like that than almost any other drug or just standard therapy sessions by themselves. First, the researchers found that people treated with psilocybin had a larger magnitude of positive response than with other treatment options. That is, they experienced stronger feelings of recovery and more profound changes in behavior and mental state with psilocybin. Second, the researchers found that the positive effects of psilocybin in therapy lasted longer than the other treatment options. The patients found that their depressive symptoms were lessened. They were happier, more self-confident, or less compulsive, or less anxious, depending on each patient's particular condition. Third, they found that psilocybin needed only be taken 2 or 3 times, which means that the dosage is far lower than that of other medications. Fourth, and perhaps most importantly, the researchers found that psilocybin is safe. It can be consumed in small amounts where the patient isn't consciously aware of any change, or amounts where they feel a slightly higher level of empathy or sensitivity. It takes a certain dose to start experiencing audio and visual hallucinations, and therapeutic doses are typically much smaller than that. The clinical trials analyzed in the research study were all phase 2 studies that examined the potential safety and efficacy of the drug. The clinical trials analyzed in this research study were all phase 2 studies that examined the potential safety and efficacy of the drug. Phase 3 studies hone in on the actual efficacy of the drug and establish it as a potentially marketable and usable medication. Unfortunately, the US federal government has encouraged very harsh laws with extreme punishments surrounding possession and use of psilocybin, prohibiting it as if it were some kind of dangerous drug that people get addicted to and suffer from. The truth is the exact opposite, but because of these laws, research into the drug has been stifled and suppressed. It's taken decades of careful legal and political maneuvering to get our research into psilocybin up to its current state. I'm glad that we're seeing reform in our cultural and legal approach towards soft drugs like cannabis, which are needlessly prohibited. Studies like this and cultural trends like that with cannabis are all coinciding with a greater push into the study of mind-altering substances, and psilocybin is no exception. Hopefully, with this study comes phase 3 trials, then eventually licensed medication, and hopefully legalization. Then we can finally have the peace of mind and political sanity to tap into the full potential of this powerful entheogenic compound called psilocybin.